Welcome to the Bright Insight Digital Health C-Suite Series. I'm Chitra Nawbatt. Joining us today is Scott Snyder, Chief Digital Officer, Eversana. Scott, welcome. Thank you for joining us.
Nice to see you, Chitra. Appreciate it.
Tell us about the company and your top 3 priorities.
So Eversana, we're not a well-kept secret anymore. We're presenting at JP Morgan this week, but we are the leading end-to-end commercialization provider in life sciences. So think of us as really the company. We don't own the product or the IP, but we partner with those companies in emerging biotech, med device, digital therapeutics, and we help do everything to bring those products to market and scale them. So that's really what Eversana is.
Walk us through, give us an example.
So an example would be, for instance, in the digital therapeutic space, MedRhythms is a product that we've partnered with. We do everything from access to brand strategy to deploying a sales force to support them, to doing patient support, being their pharmacy and their supply chain. And then underneath all that, managing the compliance and regulatory piece. So it's really an end-to-end model, and it can be flexed depending on what's needed for different products. And so for us, the biggest thing is, how do we transform the commercialization model, make it faster, better, cheaper? Number 2 is, how do we improve outcomes for patients and improve speed to therapy? Because we can affect all those pieces of the relay race. And then the last piece is, in my world, I head up digital and data. How do we use digital and data to uniquely change that journey and even give those solutions back to mid and large pharma?
So on those 3 pieces that you talked about,
yes.
How do you actually do it?
Yeah, I think that is our special sauce. I mean, obviously we have great leaders who have come together through a lot of acquisitions, but we think digital and more importantly, data and insights are really the special sauce to our platform. Being able to draw the thread from upstream where we make a patient aware that they might have a disease to bringing them into the funnel and helping accelerate and make more efficient all those steps in the journey. It really comes down to data and analytics. And then obviously digital experiences along the way, they can allow them to interact in a frictionless way.
So how can digital be an accelerator? Whether it's you yourselves or working with other digital health startups like BrightInsight? Yeah,
I mean, there's obviously the digital, digital is such a big umbrella. There's the behind the scenes digital of automation, and we're automating things like benefits verification and enrollment and all those things to take the friction out. But the market facing digital that patients and HCPs see, in that case, obviously companion apps, where patients want to drive their own journey, they want to take control of their care. That's a huge opportunity to just allow them to do it in a faster, cheaper, better way. And then digital therapeutics really take that to an extreme where you're helping a patient manage their disease and in some cases actually becoming part of the medicine that's delivered to them.
So all this sounds great, but there's still so much resistance.
Yes.
Time to action around any of these pieces takes a long time. Why is there still so much resistance, and how to get over that?
Yeah, I mean, in my old company, Mobiquity, we were in what I call Digital Health 1.0, and back then it was really hard because none of the data was integrated. Clinicians didn't want anything to do with digital medicines, and really there was no reimbursement model. And yes, we still have challenges in all those areas, but we have an opportunity to change that. So obviously reimbursement, there are payers and even the government now providing pathways to reimbursement. I think second is really bringing the clinicians into the innovation process, because I think we've all figured out you can't just throw digital technology at the problem. You have to integrate it thoughtfully into the way care is delivered. And I think more and more we're seeing digital being an augmentation to the humans in the care delivery, whether it's a clinician, whether it's a patient support rep, and really providing that additional insight or window into the patient's disease management journey. So I think those are big things. And then obviously, making sure all the data is integrated so you can get a whole view of the patient, whether it's their lifestyle data like diet or activity, integrated with what's coming out of a DTX and what we already know about the patients, their genomics, their EHR. If you can bring all that together, it's incredibly powerful, and they all provide different pieces of the puzzle. So we're seeing a great opportunity to really transform the way we help patients manage their disease.
What's the digital health trend you think will dominate market opportunity this year?
So a lot of people have been talking about and anticipating the death of third-party data or cookies, and everybody's talking about first-party data and how important it is. I like to talk about zero-party data. Zero-party data is defined as when a patient or end user willingly volunteers their data to your brand because you deliver so much benefit in their life or helping them manage their healthcare. And I think the companies that can unlock zero-party data that actually can deliver enough benefit through a digital therapeutic or a companion experience that patients are sharing more and more about their life, about their disease, so that both parties win and you create this flywheel effect of more data, more insights, better algorithms, better solutions. I think that's the key in the future, zero-party data.
Scott, thank you so much for joining us.
Yeah, happy to be here. Thank you.